we're in the lower extremity and we've been over bones. So we probably need to review joints and just make sure that you're solid on lower extremity joints. So we're gonna again go over the knee a little bit, and I have a model, a little knee model that I'll be using, kind of show up close, but also I'll be drawing on the board. Okay, so I have here a lower extremity, and it came from our old Vic the Viking skeleton. We've kind of deboned him, if you will, but we haven't completely deboned him because we kept like the extremities together. So now I can use it for online learning, this online module for you. Okay, so as a quick review of the lower extremity, so you've seen it, and you can be like, oh yeah, she said this multiple times. Okay, this is a femur, okay, and this femur sits in the thigh. If we were to orient ourselves with this one, because we've got the whole leg together, we can see that this is a left side femur. But remember, we don't want the patella like getting stuck between these two. So it kind of makes sense that there's a smooth articular surface right here for the patella on the anterior aspect, okay? So this is the head of the femur. It will fit in what's called the acetabulum of your hip. So that's like the little whole section. I did not just swear, I'll spell it for you, okay? But it fits like right into the hip there. So that's the head of the femur. And then if this is the head, there's the neck, just like we have a head and a neck. Head and the neck, okay? So this is gonna fit in the pelvis. And remember, we get lots of actions from this because it's a ball and socket joint. Ball and socket joint lets us, oh, you guys can't even see, like, look what I can do. Lots of things that I can do because it's a ball and socket joint. Think of all the actions. If we go forward, so it'll be like this, and this is sitting in the hip. We could say like, oh, we've got basically hip flexion, okay? We got hip extension. We can go out with it. We can actually come out this way. Abduct, abduction. So like our leg is being abducted by aliens, maybe, okay? So we have abduction. Then we have like circumduction, because we can actually do like a triplanar movement. I wish you could see my legs, dang it. So maybe I'll do it later. Triplanar action, whoosh, where you're actually in all three planes because it's a ball and socket. We have lots of activity here. So going with the femur still, so we've got head, neck, greater trochanter over here, this knobby little guy. And then if you kind of spin it around, you can see there's the lesser trochanter. And then we're gonna come down here. We've got the patellar groove, very nice and smooth for the patella, this boy. And then we have the lateral medial condyles, essentially these big knobby things that stick out on the sides. So out hiking yesterday, my husband was saying, I'm feeling some knee pain, and where he was pointing to, actually, we're old, but he's older. I could say that. And he's feeling the pain here, which I was like, you're a baby, A, and 2, probably quadriceps tendon. So you can tear that. My guess is that he probably, just because he's a middle-aged man, and it's their MO. Their MO is to be like, start cold and just run, or start cold and just climb up onto something. You need to warm up your muscles, and he doesn't listen. So he probably didn't warm up, and he probably has a little micro tear right in his quadriceps tendon, which is what meets up with this joint. Idiot, he needs to warm up and cool down because he's 100 years old now. So, okay, quadriceps come down, they cross this joint. So we've got the femur, understood. Then we're to a knee joint. So the knee, ideally we only get 2 actions from this because it's a different kind of a joint. So we're gonna be here, here. We've got like flexion, extension, flexion, extension. If you get anything else from the knee, that means probably that there are some structures compromised. So let's go right here to this little rock skipper. It's your patella. It's the one bone I would say, like if you found it in the forest, hey, you got a good skipping rock right there. So nice. Not much I want to say about the patella other than it's the kneecap. I will show you. I might actually do an experiment with this and show you, like, look, if you didn't have a patella, you don't get as much range of motion, which is weird to think about, that this little bone gives you extra range of motion. So right on. Okay, next up in the lower extremity is the tibia. So I'm holding a tibia here. It's not a clavicle. It's not a skull bone. It's a tibia, so large shin bone. So a couple of things that we need to know: the pillows, the knee pillows, are gonna sit right on top of these medial lateral. So in this case, if you were to say, like, well, which one is it? Well, I always identify it, like, you can find this little bump that's on the front of your leg, okay? You can find that bump, that's the tibial tuberosity. That always is gonna point anteriorly, but really the telltale sign is this little dude, is the medial malleolus. The tibia is on the medial side. So this is the right side, see? So condyle, so lateral condyle, medial condyle, tibial tuberosity, and a medial malleolus, the ankle hat, if you will, okay? Tibia. And fibula, so oriented like this. This is a right fibula. They go together like this. And see how they form like an ankle hat? Like almost like a baseball hat for the ankle bones. Nice. So this is a fibula. This is the small bone of the shin. And the distal end is the lateral malleolus. So where you can palpate that big ankle, knobby ankle bone right there, that's your lateral malleolus. Okay, and finally we're to the ankle, and we've got all the tarsals here. There's 7 total tarsals.
Wow.
2 biggies that you need to know are this one, the talus. Talus is here, and the calcaneus. So calcaneus will be where the Achilles tendon attaches. So it's gonna give you things like dorsiflexion and plantar flexion, okay? There are other bones here, 7 in total, but you only need to know talus, boink, and calcaneus, boink. But just so you've heard it, there's the cuboid, the navicular, foot bones. There are 5 in total. 1, 2, 3, 4, 5 metatarsals. It's numbered 1, 2, 3, 4, 5. 5 is the pinky toe metatarsal. And then if you look at the phalanges, do you see them? There's your pinky toe. There's your big wonky toe. This is my longest if you look at my toes. Yeah, my toes are kind of gross. Maybe I'll show you later. Fun fact, they might be grosser than yours. But we have 3 phalanx bones or phalanges in every toe, except the big one. We only have 2. Okay, so joints really quick. Hips up here, knee joint, ankle joint. Then we have where the midfoot, or these foot bones meet up with the phalanges, is the metatarsal phalangeal. So it's MP or sometimes MTP. And then we get to the acute date, which is the proximal interphalangeal joint, PIP, and then the DIP, distal interphalangeal joint.